I'm about to take you through the pre-exercise screening process. The pre-exercise screening process is used to identify people who may have medical conditions which put them at risk of ill health or physical harm during physical activity. I'll be asking you a series of questions that will help me to determine whether or not I need to refer you to a medical practitioner or other health professional before you undertake any exercise, and whether I can begin an exercise program for you so that you can engage in light to moderate intensity. You don't have to answer any of these questions if you don't want to, but if you don't answer some of the questions, I might not be able to prepare a suitable exercise program for you. Do I have your consent to collect this information?
Yes.
All right. And Luke, what is your date of birth?
22nd of the 10th, 1996.
Okay. Has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Do you experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Do you ever feel faint or have spells of dizziness during physical activity exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Do you have diabetes, type 1 or type 2 diabetes, that you've had trouble controlling your blood pressure, your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
Do you have any other medical conditions that make it dangerous for you to participate in any physical activity or exercise?
No.
Okay, well, that's wonderful. I'll just get you to sign there at the bottom of the page.
End date?
Yes, please. Okay, so that's good. That means that I don't need to refer you to a medical practitioner before you undertake any physical activities. So that means we can progress to stage 2, and this will help me determine what sort of risk factors you have and how many you have, so that I can tailor an exercise program for you. All right, so let's do the stage 2. So you're 19 years
19,
old?
yes.
Yes. Male? Okay. Family history of heart disease. Does any of your relatives have a family history of heart disease, such as stroke or heart attack? Your mother,
No.
father? No. Okay. Do you smoke, or have you smoked
No.
in the last 6 months? No. Great. Describe your current physical activity exercise level. So, would you engage in some physical activity at the moment?
Yes.
Okay, how much would you do?
You mean hours worth? Or
Yes, hours. How many times a week do you do?
3 times a week, maybe 4.
Okay, so
But 3 definitely.
3 to 4. And how long would those 3 to 4 sessions a week be?
About half an hour to 45 minutes.
30 to 45 minutes. And would you describe that as sort of moderate exercise or vigorous exercise?
Moderate.
Moderate? Okay. All right, well that's great, because let's say you do 3 at 45. That puts you at about 135 minutes of exercise per week. But that means what we do try and aim for is 150 minutes or more a week. So because you're doing less than that, that means you just have a risk factor of 1 there, because you're not quite getting enough exercise at the moment. All right, and how high do you think you are? What's your
160.
160 centimeters?
Yeah.
And your weight?
74.
74 kilos. Now I will be going through some BMI measurements with you a bit later, so I'll fill them out a bit later. Have you ever been told that you have high blood pressure?
No.
Okay. Have you been told that you have high cholesterol?
No.
Okay. Have you been told that you have high blood sugar?
No.
Have you spent any time in hospital, including day admission for any medical conditions, illnesses or injuries in the last 12 months?
No.
Are you currently taking any prescribed medications?
No.
I assume you're not pregnant or giving
No.
birth? Do you have any muscle, bone or joint pain or soreness that is made worse by physical activity?
No.
Okay. Alright, so then for the total of your stage 2 risk factors, so your risk stratification, you've got 1 because you are currently not undertaking the recommended amount of physical activity, but that still puts you in a very low risk factor in terms of exercise. That means that if you're in a low risk, you can participate in aerobic physical activity up to a vigorous or high intensity. So that means here, if you look at the intensity guidelines, a vigorous exercise is an aerobic activity in which conversation generally can't be maintained uninterrupted, and an intensity that may last up to about 30 minutes. And in terms of your perceived exertion measure, that would be a 5 to 6 out of 10. A high intensity is a perceived exertion measure of greater than 7 out of 10, and it's an intensity that generally can't be sustained for longer than about 10 minutes, so very high intensity. So that's great news. That means I don't need to refer you to a medical practitioner and we can undertake some exercise today.